Alright, so I'm Nurse Ryan. So I work here in the emergency department. And the first thing that I would do is I would take the handoff report from the EMS. Again, we're going to follow the SBAR method, situation, background, assessment, and recommendations. So even before JT comes here to the hospital, I'm going to ask the EMS people, the first responders, like some information so that we can actually prepare the unit in taking the patient. It's going to be, our goal is to have a effective, smooth operation so that it's less stressful for everybody, including the patient, and also to provide a better care. So once JT comes here to the hospital, I'm gonna do a primary assessment as a nurse, making sure that he is in stable condition, that his pain is taken care of. Also, because this is a vehicular accident, I need to also relay the info to his family members, making sure that they're up to date on what's going on so that they're not going to be worried. Because aside from being physically injured, you know, as a young guy, it's also a traumatic experience for Taylor, especially he knows that this incident might be a factor in his scholarship. So all those worries are coming into him. So as a nurse also, once we get him stabilized and transferred over to the med-surg unit, then he's gonna be, you know, I'm gonna delegate some tasks to my fellow co-workers, my LPNs or the techs, to keep on checking his vital signs every so often. And then also I'm going to take all the other information pertinent for him that needs to be included in nursing notes so that the physician should be able to diagnose his condition or whatever is wrong, and then so we can actually intervene properly and at the earliest time possible.
Hello, I'm Dr. Kyle. I will be the physician here in the ER in charge of JT's care. So what I will be doing is starting with discussing with my staff kind of what's going on with JT, get a nice idea, speaking with the nurses that are on his case, and then based on what they tell me and per their initial assessment, order the appropriate lab work, imaging studies, and medications to ensure that he is comfortable while here. From there, I will go see JT and perform a detailed assessment, including a history and physical, and coordinate with any other specialties that I may feel necessary to ensure that he gets the best care possible while here in the ER. Once we get all those results from the different labs and the imaging, I will combine those with my history and physical along with what the nursing staff have told me and come up with an initial working diagnosis. I will explain it to JT and any family members that may be there and ensure that they fully comprehend everything that we discuss and are comfortable with the care plan that we come up with. From there, we will ensure that JT is medically stable enough to be discharged and ensure that he has all of the proper outpatient referrals that he will need for the next couple of weeks.
The hospital administrator overseeing JT's case. My role is to ensure that all departments involved in JT's care, from EMS to discharge, are effectively coordinated and that the hospital resources are efficiently utilized. Upon JT's arrival, I will work closely with the ER physician, the nursing staff, the ancillary services to facilitate communication and streamline his care. This includes ensuring that JT has access to all the necessary services and specialists he needs, such as sports medicine, dentistry, physical therapy, and support services like social work and case management. Additionally, I will coordinate with the community partners, including rehabilitation services, the scholarship committee, and social support organizations to ensure JT receives comprehensive post-hospital care. My priority is to ensure that his treatment plan is not only medically sound, but also addresses his long-term well-being, academic commitments, and athletic career.
I'm Kyle. I'm the occupational therapist that will be working with JT. So he was referred to us due to post-concussive syndrome and shoulder issues. So we're going to start with an evaluation, see how he's doing, see how much of his daily activities he can do, how much these issues are limiting him. From there, we'll come up with a comprehensive plan that will help treat both his concussion as well as the shoulder injury, and hopefully within the next few weeks we can get him back to at least close to his baseline, and make sure he's able to perform all of his daily activities pain-free.
Arya, the social worker, and here at the hospital, my role is to ensure that JT and his family have access to the necessary support services during his recovery. I will be assessing JT's social and emotional needs, coordinating with his aunt Rosie, who is his primary caregiver, and ensuring that his younger brother Ashton also has the necessary support. I will also connect with JT's community resources like counseling, financial assistance, and rehabilitation services. Since JT is a student athlete, I will collaborate with the scholarship committee to ensure that his NIL contract and academic standing are definitely not impacted by this injury. Additionally, I will assist his friend Casey, who sustained a fractured leg, and ensure that he receives follow-up care. All here to support you through this recovery process. I have been in touch with the doctors and the medical team and the nursing staff to stay updated on your progress. Once you're cleared by the doctors and physical therapists, we'll work on a gradual plan to get you back in shape safely. No need to rush. Your long-term recovery and well-being is what matters the most. In the meantime, I will coordinate with the scholarship committee to ensure your NIL contract and academic eligibility are stable to remain intact while you focus on your recovery. If there's anything else I can do to help, you've got the entire team. Just let me know. You've got the entire team behind you. Stay strong, stay safe, and take care.